Hi YouTube, it's Catherine Michelle. Today I'm going to go over the autopsy of George Floyd. I waited a while on purpose just so things could calm down. This video, I will probably turn off comments because I don't want this to turn into people bickering and condemning this or that. That's not the purpose of this. The purpose of this is strictly to go over what the medical findings are and were in his case. I am aware that there is supposed to be an autopsy that was performed by independent doctors. I do not have that written document. So when and if that ever becomes available, I will go back and do one covering what they say they found in that one. But for today, we're just going to stick with what the Hennepin County Medical Examiner found during their autopsy. So basically, the final diagnosis is as follows. 46-year-old man who became unresponsive while being restrained by law enforcement officers. He received emergency medical care in the field and subsequently in the Hennepin Healthcare Emergency Department, but could not be resuscitated. Now it goes on to list the injuries he sustained. Blunt force injuries. Cutaneous blunt force injuries of the forehead, face, and upper lip. Mucosal injuries of the lips. Cutaneous blunt force injuries of the shoulders, hands, elbows, and legs. Patterned contusions in some areas abraded of the wrists consistent with restraints or handcuffs. Okay, so just a brief explanation of that. Blunt force, when it talks about blunt force injuries, a blunt force injury is anything basically that's going to cause marks on the skin. And so sometimes people will understand it to mean like it comes from a bat, a crowbar, car, but it's actually more than that. Anything that creates a bruise, an abrasion, and in this instance, the brick wall, the street, handcuffs, these all created these injuries. They're all consistent with what is on the video, and they're just listing what they found. Now the next part, section number 2, is where it becomes a little more enlightening as to what probably contributed to his death. It's 2 natural diseases. Arteriosclerotic heart disease, multifocal severe. That was A. B. Hypertensive heart disease. B1. Cardiomegaly, 540 grams, with mild biventricular dilation. B2. Clinical history of hypertension. Then C. Left pelvic tumor, incidental, see microscopic description. So he had atherosclerosis. He had cardiac disease of his arteries and stuff around his heart. He had cardiomegaly, which is an enlarged heart. 540 grams is a pretty good size heart, much larger than what you would want. And a clinical history of hypertension. Untreated hypertension leads to cardiomegaly. The left pelvic tumor is really incidental. It's something they found upon autopsy, has no bearing on his death whatsoever. Now we go on to number 3. So the first one was the blunt force injuries. Second was natural diseases. The third is no life-threatening injuries identified. No facial, oral mucosa, or conjunctival petechiae. No injuries of anterior muscles of neck or laryngeal structures. No scalp soft tissue, skull, or brain injuries. No chest wall soft tissue injuries, rib fractures other than a single rib fracture from CPR, vertebral column injuries, or visceral injuries. Incision and subcutaneous dissection of posterior and lateral neck, shoulders, back, flanks, and buttocks, negative for occult trauma. Now, to help explain that, so obviously he had no, and when it says no life-threatening, so this section is not talking about the scrapes and the bruises on his mouth. So when it says no life-threatening injuries of the face, oral mucosa, or conjunctival petechiae, it means that, there was no facial fractures, there was nothing blocking his airway, and the little pinpoint red dots that you see with strangulation and severe prolonged like pressure on a neck to stop the blood from flowing, which then tends to pool in an area, it can't go anywhere, which causes that pressure, then causes the veins to rupture, which you see these little pinpoint red dots, petechiae. None of that is found. No injuries of the anterior muscles of the neck or laryngeal structures. So on the front of his neck area, no injuries whatsoever. No scalp, soft tissue, skull, or brain injuries. So he didn't have swelling of the brain. His scalp was not fractured. There were no lacerations. And so, again, nothing that would cause death. So other than, again, we're not talking about the scrapes, the minor scrapes and bruising. No chest wall soft tissue injuries, rib fractures other than a single rib fracture from CPR, vertebral column injuries, or visceral injuries. So, in other words, there's nothing internal that would show them that he suffered major trauma that would have led to his death. And then incision and subcutaneous dissection of posterior and lateral neck, shoulders, back, flanks, and buttocks, negative for occult trauma. So not only did they check the front of his body, but they did an incision and checked the back as well. They pulled back and looked at his muscle to see if there was any bruising, to show where extreme pressure had been applied, and which enough would have caused bruising or injury to his neck, his back, and there was nothing there. And then now number 4, viral testing positive for 2019 nCoV RNA by PCRA. 4, hemoglobin S quantitation, postmortem femoral blood, and then they'll go on at 38%. They'll see the comments. We'll talk about that later. And again, his testing positive for COVID-19 had no bearing on his death. He was either exposed or had it. Recently could be anywhere from, a few days to months. But he did test positive and had been infected with COVID-19. Again, no bearing on his death. And we will talk more about the hemoglobin S quantitation later. Now we're down to the toxicology section. This is where we begin to see another thing that led to his death. Now, I know a lot of people don't want to hear this, but it is what it is. This is what was found in his system. So we have toxicology testing performed on antemortem blood specimens collected at 9:20 p.m. and on postmortem urine. So the antemortem was the blood they collected before he died, and then the postmortem urine they collected from his bladder after he died. So A, the blood, drug, and novel psychoactive substance screens, and what they found were fentanyl, norfentanyl, 4-AMPP, methamphetamine, 11-hydroxydelta-9 THC, cotinine, and caffeine. So basically the cotinine is nicotine, and caffeine, we all know what caffeine is, and then THC, pot. The blood volatiles, negative for ethanol, methanol, isopropanol, and acetone. So he wasn't drunk and had not been drinking. His urine drug screen was presumptive positive for cannabinoids, amphetamines, and fentanyl. So it was detected in his urine, which means he had ingested all of this stuff relatively close to when he died. And then it says urine drug screen confirmation morphine free 86 NGs. Now, Not sure what that was all about. Could that have been part of the amphetamines, methamphetamines? I don't know. But now we're going down to the comments. If when we see above where it's talking about the hemoglobin S quantitation, now here's where it's going to talk about that. The finding of sickle-celled appearing cells in many of the autopsy tissue sections prompted the hemoglobin S quantitation report above. So when they saw the sickled cells under the microscope upon, after he died and they drew the blood, then they went ahead and they did this next test. Red blood cells in individuals with sickle cell trait are known to sickle as a postmortem artifact. So in other words, the sickle cells, it doesn't mean it's something that just happened because he had the trait for sickle cell. He was not currently active, did not have sickle cell anemia. It's just what happened in his blood when he died. So again, had no bearing on his life or his death. And it goes on to explain further, the decedent was known to be positive for 2019 nCoV RNA. Since PCR positivity for 2019 nCoV RNA can persist for weeks after the onset and resolution of clinical disease, the autopsy result most likely reflects asymptomatic but persistent PCR positivity from previous infection. So what they are saying is that he was infected, they don't know when, but it was before, but it was still active in his system. So in other words, regardless of whether he was symptomatic or asymptomatic, he still had it, and he was probably shedding virus. But again, has nothing to do with his death. It just is what it is. Now, we're going to go on down to medical intervention, which talks about what they did. It looks to me like they did put in a chest tube to drain some fluid. Could have been that a lung collapsed. They had the endotracheal tube in, all types of IV sites and where they drew blood. All this is normal. And then evidence of injury. Now we'll go on, and it starts to list all of the abrasions and the bruises that he suffered. There were several. Let's see how many. 1, 2, 3, 4, 5, 6, 7, 8, 9 places where he had abrasions and bruises. And I believe that was on his head and neck. And you can see that in the video where he's like face down and he's lifting his head up and he's scraping his head on the street, on the tar. And so it makes sense. These injuries are consistent with what you see and how you see him and how his face is making contact with that pavement. Then it goes on to describe the shoulders and extremities. He has 1, 2, 3, 4, 5, 6, 7, 8, 9 places where they describe, again, abrasions. And an abrasion is just the scraping. There will be 3 types of injuries generally to the skin. You will have a laceration where it's cut. Everybody knows what a laceration is. Abraded or an abrasion is where it's scraping. Think road rash. And then contusions or bruising. So this goes on to explain the contusions and the abrasions that he had on his shoulders and extremities. And then, of course, his wrists and hands, he had handcuffs on, so it was inevitable. There was going to be abrasions and contusions with that as well. Now, and then it goes on to talk about the rest of his body, which doesn't matter. We don't need to read that. But we need to get here. Here's a part where we do need to read. It's the cardiovascular system. Now, this is really important. The 540-gram heart. Now, keep in mind the upper limit of normal. So the high end of normal, which is not what most people are going to be, but the high end of normal for his body height is 510 grams. And the upper normal of limit for his weight is 521 grams, which is still pretty big because he was a big, solid guy. So you would expect his heart to be a little bit bigger. However, 540-gram heart, a cardiomegaly like that, even in someone of his height and weight, is an enlarged heart, and that is not good news. Now, this is the problem. He looked healthy and strong and great on the outside, but the inside of his body is telling you a completely different story. So let's go on. He had a 540-gram heart. The epicardial surface is smooth with modest fat investment. Again, normal to have some fat around the heart. The coronary arteries are present in a normal distribution with a right dominant pattern. Hold on. Sorry about that. Phone's always ringing over here. Now, this is where it's going to talk about when they dissected the heart and then looked at his arteries. Again, now this is showing he was not a healthy man. The cross sections of the vessel show multifocal atherosclerosis with 75% proximal and 75% mid-narrowing of the left anterior descending coronary artery. In other words, the left descending coronary artery is known what most people refer to as the widowmaker. And a 75% narrowing is pretty intense for the amount of section that was narrowed. A lot of people will have like a small section here or a small section in the mid, but his seems to be diffuse, so to speak. And then it has a 75% proximal narrowing of the first diagonal branch of the left anterior descending artery. So as you have the main arteries, and then from those arteries branch off other smaller arteries. And one of the first branches, that first diagonal branch, was also 75% occluded. And then it says 25% proximal being nearer to, distal farther away from the center of the body. So that proximal closer to. 25% proximal narrowing of the circumflex coronary artery, which actually that part's pretty good. Most people of his age could have 40% blockage in the circumflex and still be perfectly fine. His was 25%, so that was pretty good. And then it goes on to state that 90% proximal narrowing of the right coronary artery. And that is severe. That is really bad. That can easily lead to death once, if a full-fledged cardiac event, cardiac arrest takes place, and you are not in an OR having an angiogram done, so to speak. Even at that point, you still may be lost. But it's not good news, not a healthy heart. It goes on to talk about everything. All these other organs are good. We don't need to talk about any of those. So it talks about the special procedures, how they did the Y-cut, how they found it. They took digital photographs, postmortem specimens, and again, the dissected organs are returned to the body. Everything from that point on is normal. And then reading through the rest of it, everything looks pretty good. So, why is this important? I have watched the video, and when Mr. Floyd is, I see him first being handcuffed, and one of the officers is walking him, looks like to an area where he can kind of rest. You see him, Mr. Floyd, stumbling. He's clearly under the influence of something. Well, now they know, according to toxicology reports, he had quite a bit of stuff in his system. But then he gets up and he, like most of us do, we get close to a wall, we just kind of slam back, right? It's just what we do. But then then you see him slide down. It's like a brick wall and he's sliding down. So that's going to cause abrasions and scraping on the back of his shoulders because he had a tank top on. Again, consistent with what they find in the autopsy. So I'm sorry. I'm so tired. I'm trying to think of what else we were going with. And the video also shows that, okay, he was under the influence. He fell back. He scraped his shoulders as he's sliding down the wall to sit down. And then eventually they pick him up and they go to put him into the back of the vehicle. And then they take him out right away. Now, I don't see and have not seen the other side where and that part is where it is stated that when he's put in the vehicle, he says he's getting claustrophobic. And so they take him out of the vehicle. To me, and in my opinion, and I'm entitled to it, my opinion is that this is where I see the officers failed Mr. Floyd for the first time. And why I say that is because they don't know his medical history. They have no idea. However, one of the first signs and symptoms of a heart attack is a feeling of your claustrophobia, you're phobic. You can't be in a tight space or what you perceive to be an enclosed space. So right away he starts doing that. And as he's getting out, he's more and more agitated. And he is combative. It's there. You see it as plain as day. He's combative. However, caveat here. Again, the police officers don't know why. Now, in their job, it is safe to assume that they probably deal with people like this all the time. But that is one of the bad things in a situation like that, when you're so used to dealing with people who are combative that you don't always stop to think after a while, okay, is this person really sick? Or are they just being a jerk? And I don't know. I wasn't in those officers' heads. I did not hear any racial slurs being yelled to anybody. I didn't see a roughing up or mishandling of Mr. Floyd. What I see is they didn't tend to take anything he was saying seriously. Again, that's up to the courts to decide, and that evidence will then be brought in a court of law. This isn't about trying the police officers here. This is about explaining what I saw in the video and what the autopsy reports are telling us. So as he's being combative, then eventually he is put down on the ground. And then that's when the officer puts the knee on the neck. Now, this is where people were saying he died because the officer was applying so much pressure to the man's neck. I disagree. Why? Because the autopsy reports show no bruising on the neck whatsoever. And you would have to apply a pretty good amount of force onto that neck to stop the blood from flowing. And another reason why I don't believe that's true, because in the video, you see him lifting up his head, even though the knee is on his neck, and I don't agree with that. I don't like that method whatsoever. That's not the issue here. Is even though the knee is on the neck, you can see Mr. Floyd lifting his head, and he's moving it, and he's scraping his face on the street. Now, if there was so much pressure applied that it was cutting off circulation, he would not have been able to move his head like that. So I don't buy that. Not at all. But again, I don't agree with putting knees on necks. I don't agree with putting knees on the backs. I don't agree with that behavior whatsoever. I think that is something no police officer should have ever been taught. And they do it all over the country, all over the world. It's just not right. So what I see happening is, and what the evidence is explaining and showing to me, is that Mr. Floyd died from cardiac arrest, aka a heart attack, brought on by. And here's where it gets really sad. So I call this the if not fors. If not for the fact that he did not take medication for his hypertension, and we know he didn't. It was not found in his system at all. There were no hypertensive medications detected. So if not for the fact that he had untreated hypertension, if not for the fact that he had an enlarged heart, if not for the fact that he had fentanyl, amphetamines, nicotine, THC, and caffeine in his system. If not for the fact that arrest is very stressful. If not for the fact that the police officers did not stop and render aid and take him to the hospital when they first noticed he was in distress, things could have been different. However, that's not how it played out. The officers didn't pay attention, especially when he stopped moving. They didn't pay attention. Mr. Floyd did not pay attention when he was told he had hypertension. He didn't take care of his heart. Due to not taking care of his heart, he had an enlarged heart. And an enlarged heart does not work well. If not for the fact that Mr. Floyd was taking fentanyl. Now, there is nothing in his medical history or what they found on autopsy that would explain a medical reason for needing fentanyl and the methamphetamines. It's an illegal activity. Unless they can show that he had a medical reason, and we don't know this because we don't have access to all of his records, but regardless, legal or illegal, these drugs have an effect on the heart. So does THC, so does nicotine, so does caffeine. So he didn't take care of his health. And then you put on top of that the stress of being arrested. And it was the perfect storm. The other place where I see the officers failed to render aid was once he became unresponsive. They should have stopped at that point, checked him, and did an exam. They did not do that. And here's where I think it's great that people are around and filming things. God bless you for doing it. Because without that, we wouldn't be able to see what really happened. However, what you also don't realize is that behavior then becomes an aggressiveness to a scene you don't understand that you're creating. Unfortunately, that's what happens. So all of these things are leading up to a really bad outcome. Now, I have heard and saw where the other doctor, Dr. Baden, states that Mr. Floyd was probably dead for many minutes. That is an irresponsible and unconscionable comment to make. You don't know that. Nobody knows that. And any medical physician who would look at that video and make that comment, they need to go back and retake that section in school. And here, let me explain why. As an EMT, when we would roll up on scene and we see someone unconscious, our first thought, and unresponsive, our first thought is not, oh, look, they're dead. You killed them, they're dead. Our first thought is, okay, they're unresponsive. Why? Let's figure out why. And so when they pick up Mr. Floyd from the ground and put him on the gurney and his head is flopping down, the only thing that video tells you is he is unresponsive. That's all you know. End of story. It's all you know legally. It's all you know medically. Unless you were standing there taking that man's pulse the moment that they picked him up off the ground, you don't know. And because, there just is so much at play here. Now, once they get him in the rig, and then also I've had and read comments, I've had people say to me, and I've read comments that, well, they didn't just stop and they should have done this and they should have done that. They didn't do IVs. They didn't start CPR. This should let you know you don't know how these situations work. In a load and go situation like this, a load and go is a patient that is severe, and what you do is you get him on that gurney, you get him in the rig, and you leave and you head to that hospital as quickly as you can. You start treatment and assessment once you are inside that rig, not on scene, because on scene you're wasting valuable time. So what they did was correct. They picked him up, he was unresponsive, they put him on that gurney, they got him on the rig, and they took off. Proper protocol all the way around. So since we don't know, and all we know is he's unresponsive, you can't say he died. They worked on him for a while. He was not pronounced dead until at the hospital when they tried numerous medical procedures to try to resuscitate him, and they didn't work. Then and only then does the doctor on call and working him call the time of death. And also you need, what a lot of people don't seem to understand is they could say, well, he wasn't breathing. I don't know. I didn't see it in the video. I couldn't see whether his chest was or was not. Even when he was talking, I couldn't see his chest moving up and down. So I'm not going to try to make that judgment call. However, what you need to understand is that just because a person stops breathing does not mean that their heart is not pumping. And as you breathe, the oxygenated blood stays in the system for a while. This is why they eventually learned with CPR that you don't have to constantly give what they called rescue breaths, because before you do the breathing a few times, chest compressions, breathing, they learned that you don't have to, because as you breathe in just once or twice, or if you have an ambu bag and you're pumping, whatever the case may be, that oxygen stays in the blood for a while. As long as the heart is pumping and chest compressions are going, and or one or the other, the oxygen is moving throughout the system. The brain is still getting that oxygen. So that's a good thing. So you don't understand that. There's a whole list of reasons why this happens. So the way I see it and how this evidence speaks to me is that Mr. Floyd had everything going against him that day. He shouldn't have been out. We can say this. Hindsight's always 20/20. But he should not have been out roaming around anywhere, being under the influence of the drugs that he had in his system. Because again, you clearly see him staggering. You clearly see he cannot walk in a straight line. And then, okay, so you've got that. And another thing I want to bring up here too is when he starts to say he's claustrophobic. Oftentimes, when people start to have a cardiac event and they start to have, sometimes panic attacks will do this as well, but the cardiac event begins, they will feel claustrophobic. You feel like you can't breathe, even though we're talking and exchanging air. And obviously you're exchanging air and you are breathing if you were having a conversation. That doesn't take a genius to figure that out. You have to be breathing in order to communicate verbally. Now, so you have him, and again, the officers, the moment he started saying, I feel real claustrophobic, I can't breathe, I don't know. And they should have said, ding, 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 ding. There should have been a bulb going off in the back of their head. There's something going on here. Now, also another thing that police officers, I don't believe, are ever taught enough, and that is when the brain begins to lack oxygen and or blood, people become physically combative. And those of you who like to fight the cops because you're jerks, there's a difference between being physically combative because you're an ass versus being physically combative due to a lack of oxygen. Now, that I do see some of that as being a very strong possibility for Mr. Floyd. That his combativeness was more than likely, again, I don't know, I don't have all of the reports, but more than likely it makes sense that the combativeness began and was all part of the cardiac event. He's beginning to panic, he's being afraid, he's scared, which who wouldn't be? And then the brain begins to get less and less oxygen due to the panicking and not breathing correctly, and due to the event of the heart's not pumping correctly. And it was a very bad domino effect. So what I see as the cause of death is he died from a massive coronary. That coronary probably brought on by the stress of the arrest, by his medical history, by the drugs in his system, and the police officers failed at their job by failing to provide lack of care. I mean, they didn't provide care. It was a total lack of care. Reckless. Reckless is a good word. They were very reckless in how they handled him. And because of that reckless behavior, and because of the drugs in his system, and because he didn't take care of his heart, and because, all of that culminated into the perfect storm, which led to his death. It's horribly sad. I do not see this. Nothing in this report, nothing in the video I have seen, nothing has said to me or shown to me this had anything to do with the color of anybody's skin. There was a black officer there, a white officer there, an officer of either Latino or Asian. They were there. You can't say this was racially motivated, but I can say with certainty that it was reckless behavior on the part of the police officers. If they had done what they needed to do and did their job and took him and called the ambulance right away, or just take the man to the hospital, could he have lived? I don't know. It's something we will never know. Were the odds in his favor? No. Not according to his autopsy and the condition of his heart and his atherosclerosis. The odds were not in his favor. The cardiac event had already begun. There would have been no way for those doctors to run all those tests, to do all that, to find out that it was a blockage. It was too late. And that's why a lot of people, they just drop dead. They don't know they have atherosclerosis. They don't know they have cardiac disease, etc., which is that, and then some. And then they just drop dead. You can't be saved. That's why they call it the silent killer. So if anything, please, people, take your health seriously. Take your family's health seriously. And please understand that what you see and what you hear is not necessarily the events taking place. If you don't know how to look at that scene, if you don't know what you're seeing and you know how to read it, you are basing your conclusions on your emotional response to something you do not understand. That's dangerous. I hope everybody takes this as an opportunity to go online, go to your library, take an EMT course, do something, learn about what happens to the body with cardiac disease, and then take care of yourself and your family. The only thing I have to say is I'm sorry to his family that they lost their family member. It's very sad he died. But again, I cannot reiterate this enough. I see absolutely zero evidence that this was racially motivated.